Today we are doing the SAFE Assessment Tool, which is a 2-page screening tool intended to be used in addition to discipline-specific assessments for seniors living independently in their homes or in independent living facilities who report a history of falls. Information for SAFE can be obtained via direct questioning and observation, as we will demonstrate here. However, a person with mild dementia may require the support of a carer to answer the questions. Okay, so today I'm going to start with asking you a few questions about your history, recent falls, intrinsic factors, extrinsic factors, and areas of your daily life. Okay. So first, do you use a mobility aid such as a walker or a cane?
No.
Okay. And is there anything in your recent medical history that you think is relevant to your falls?
Not that I can think of.
Okay, thank you. Do you currently take any medications?
Yes.
Could you tell me what they are?
Pertaining to falls, you mean, or getting dizzy or stuff like that?
Well, any medications that would include antidepressants, Parkinson's disease drugs, diuretics, sedatives, hypertensives, or psychotic drugs?
No.
Okay, thank you. And do you live alone, or do you have a family support that lives with you?
My husband lives with me.
Okay, thank you very much. And how long ago was your most recent fall, or have you fallen recently?
I haven't fallen recently.
Okay. So now we're going to talk about some intrinsic factors. So do you ever experience symptoms of dizziness?
No.
No. Excellent. What about fluctuating function during the day? Do you find that it's easier to do something at one part of the day that's been difficult to do at a different part?
No.
No. Okay, excellent. Do you have difficulty managing your medications?
No.
No. And have you fallen and you don't know why? You don't know the cause of the fall?
No.
No. Excellent. And do you ever experience unsteadiness when you first stand?
No.
Excellent. Okay. So do you ever sway when you're walking or feel that you need to use furniture to help you walk?
No.
Excellent. Do you have a weakness or reduced sensation in one leg or the other?
No.
Have you ever tripped when walking and you looked and could not see an obstacle that had tripped you?
No. Usually I trip over rugs or stuff like that.
Okay, usually there's a reason.
Mm-hmm.
Okay. Do you have ill-fitting or unsupportive footwear that causes your feet to experience pain?
Sometimes, probably yes. I'll
Okay.
have shoes that are too tight.
Okay. Now, as far as your vision goes, do you have difficulty seeing steps or obstacles around the house?
No.
Do you ever walk around in dim light?
Yes.
Yes. Okay. Can you tell me a little bit about when that happens?
When I go to the restroom at night.
Okay. That makes sense. Okay.
Or when I walk in from, if it's the evening and I walk in and the lights are off.
Yep. Okay. And have you had a vision assessment in the past 12 months?
No, I need to go.
Okay.
I've been telling myself I'm going to go and I haven't.
That's okay. I just went recently too. Okay. Are you concerned about falling in the future?
No.
Okay. Have you experienced unexplained weight loss recently?
No.
And do you have poor appetite?
No.
Okay. Okay, as far as your cognition goes, do you ever have difficulty following instructions or getting confused with instructions?
No.
Okay.
I don't think so.
Okay, you seem like you're doing good. Okay, so this is as far as continence control goes. Have you had any issues with continence control?
No.
Okay. Do you restrict any activities? Do you purposely avoid certain activities because of a fear of falling?
You mean like walking or dancing or?
Exactly. I mean, anything. Is there anything that you purposely don't do that you would like to do because...
No.
Okay. And do you take 2 or more of the following medications, which is what I read before as far as antidepressants, Parkinson's disease drugs, diuretics, sedatives, antihypertensives, or psychotropic drugs?
No.
Okay. Okay. As far as extrinsic factors, so things that are surrounding you in the environment,
Mm-hmm.
do you have any difficulty climbing steps in the house?
No.
Okay. And do you have any difficulty getting on or off of the bed?
No.
On or off of the chair?
No.
On or off of a toilet?
No.
Or in and out of the shower?
No.
Okay, excellent. And do you feel that there is poor lighting inside or outside?
Inside or outside the house?
Mm-hmm.
No.
No. Now we're going to talk about activities of daily living. Is there any activity that you feel unsafe performing, such as reaching up hot for high things on shelves?
No.
Okay. Do you have difficulty reaching for, bending, or carrying items?
Tell me that again.
Do you have difficulty reaching for an item, bending down for an item, or carrying items?
Well, if they're too heavy, sometimes, I kind of have a fat back, so sometimes I have to be careful with that.
Okay. So maybe not difficulty, but a little bit if they're too heavy. Okay. Do you ever feel unsteady when you're rushing or if you turn too quickly?
No.
Do you feel that you have difficulty when you are trying to wash your hair, to shower, or to dress yourself?
No.
And if you're ever sitting on the floor, is it difficult to stand up?
No.
Okay. Now this is about your activity. So, do you leave the residence, your home, less than 1 time a week? Or do you leave it more than 1 time a week?
More than 1 time.
Okay. And as far as physical activity, do you feel that you walk for at least 15 minutes more than 5 times a week?
Yes.
Okay. Okay, now we're going to do your independence profile, how you are as far as your independence goes. So do you receive assistance for personal care?
No.
Okay. Do you receive supervision for being mobile or active, either around the home or outside the home?
No.
Okay. And do you have any current home services, such as home help or gardening, an RDNS, or anything else?
No.
Okay. And do you feel that you have support that is sufficient for your needs?
You mean other people helping me out?
Right, like support either in your activities around the home or support in...
Family?
Yeah.
Yes.
You feel it's sufficient? Okay. Okay, we are done with this portion of the assessment. Now I'm going to add up your scores and then we'll go over it together.
Okay.
Okay, now we're going to go over the scoring of your assessment. As you can see, we have yeses and nos for each question that I asked. And the more yeses that you had, the more risk you're at for that being a factor of falling. In your intrinsic factors, you only had 2 yeses out of 21, which is an overall very low risk. The things that you answered yes to were having ill-fitting or unsupportive footwear, as well as sometimes you have not had your vision checked in the past 12 months, which you are intending to do, which is excellent. However, you don't have any history of bad vision. Is that correct?
That's correct.
So that is, even though you haven't been checked, that's still a low risk. And wearing unsupportive footwear sometimes also is something that you could either remedy if you would like, or is still very low risk. In the extrinsic factors, you scored 0 yeses out of 6, so you are at no risk in that section. And in the activities of daily living, you only answered 1 yes out of 11, and that was that you sometimes carry, bend, or reach for items that are too heavy. So this is the one area that we could work on, and that would be assessing the item before you decide to carry it. And if you think that it's too heavy, then coming up with an alternate method, perhaps making it lighter if it's groceries, or asking for some help from someone who you believe is stronger and could handle the burden easier.
Yeah, it sounds good. I'll wait for my husband to come home.
Okay, excellent. So overall, you're at a very low risk of falling, and thank you for doing the assessment today.
Well, thank you.